Good morning. My name is Dr. Sean Price. I'm here at Cairo Spa in Fort Walton Beach. I am clinical director here at Cairo Spa, and I'm going to do a series of videos on weight loss, and this is the first in that series. And purpose in doing this is because number one, there's a lot of reasons why people set weight loss goals, especially for their New Year's resolutions in January, and by this time in February, most people, to be quite honest with you, have given up and they've stopped and they've honestly failed at their goal. So there's a reason for that, and so the series of videos that we're going to be doing is intended to help you understand why, and understand how to help you actually achieve long-term weight loss. But the first thing I want to go over in this series is that while we like to focus on weight, we like to focus on moving the scale down. That's really not the reason why you should undertake a weight loss program. As you know, in our office, we treat a lot of patients with chronic conditions such as hypothyroidism. We work with patients with fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome, Crohn's disease, all kinds of different chronic conditions. And the purpose of what we do in our office is to help them recover health, to help them recover function. We don't chase symptoms, we don't chase diseases, we get to the core of what's going on in the body, why the body's malfunctioning, and then help the body restore that function. And it's no different with weight loss. When you have excess weight on your body, that is a symptom. It is your body actually doing what it's designed to do, but it's doing it in response to either excesses or poor decisions that you're making throughout the day. So you can't criticize your body for having this excess weight, when a lot of times it's a protective mechanism that your body uses in response to something that's happening in your day-to-day life. So the first thing is we have to handle the cause of why the weight issue is happening. It's not as simple as calories in, calories out, which is what a lot of the weight loss programs out there, for example, Weight Watchers and Nutrisystem and things along those lines. There's a lot more to it, and that's why people in our society cannot achieve long-term weight loss. So that's the weight loss aspect of it. But again, we're focusing on function, because here's the fact. I've got some statistics up here, and all of these factors are affected by the same things that are affecting your weight. So for example, 75% of Americans are either overweight or obese. Of course, that's affecting your weight. 1 in 3 are either diabetic or pre-diabetic. Blood sugar handling is a major cause of malfunction in our society. And I've done a ton of videos on that, and there'll be many more coming. But diabetes is, in most cases, it's absolutely preventable, and many times it's actually curable, but it's a lifestyle-based issue. So that's something that needs to be handled. 1 in 3 patients are going to develop cancer. There are several factors that go into cancer development. There's genetic predisposition, there's genetic mutation. There's a lot of also environmental factors. There have been studies out there that have shown that if you can change your lifestyle factors, you can prevent and eliminate up to 38% of all cancers. I mean, that's a critical information. 1 in 4 are going to develop heart disease, totally lifestyle related, totally dietary, exercise, mental attitude, all these different things that we have control over. And then the USA is actually ranked, it depends on what study you look at, we're always ranked towards the bottom of the countries that are being compared. And in one study by the World Health Organization, we ranked number 35 out of the developed countries in overall health. But the key to that is we spend twice as much money on healthcare as our next competitor. As the person ranked, or the country ranked number 2 on that list, we spend twice as much as that country in our healthcare, and yet we're ranked number 35. So what that should tell you is that what we're doing is not working. We're spending the money, we're doing what we think is the right thing, we're trying all these things, we're taking the medications, we're trying all these fad diets, we're doing all this, but it's not working. We're still number 35 in overall health. And 1 in 4 Americans are on 1 or more drugs. Now, all of these factors are preventable by proper lifestyle, by proper dietary habit, by healing and supporting normal body function. If you're over 35, at least one, but probably multiple of these factors are affecting you or people in your life. So this is the first point that I want to make, is weight loss. It's nice to lose weight, but it's even better to gain function, gain health, gain your lifestyle back, be able to do the things that you used to be able to do. Just because you're aging does not mean that you have to reduce your activities and give up on the things you want to do. I'm 45 years old and I can do things now that I couldn't do when I was in my 20s. So you can get stronger, you can get healthier as you get older. So I hope this makes sense, and in next week's video we're going to talk about why people actually fail with long-term weight loss. Have a great day.